am back to do a very short video about a thing that's called a port. Now, can you see this little bump in my shoulder blade? This is, they have a number of names for it, but I call it a port. And it was surgically inserted in this location. All right. And it's got this other exterior bit attached to it. So it was an inpatient thing. They put you out for a couple of hours. The doctor inserts the port, and you use this port to take up your chemotherapy drugs. All right. So instead of them putting a line intravenously into a vein, this is a way to make things easier for you, essentially. I can't tell you how many times I've been poked and pierced with needles and blood drawn and this done and that done over the course of 6 months, and sometimes multiple times. And I'm going to do a separate video on blood transfusions later. But this one is just about the port, and it's going to be very quick. If you're watching this video before you have your treatments, go get your port done. All right, this will just make your life a whole lot easier. And nowadays they have ports that are completely enclosed. All right, so the level of infection rate is a lot less, and I'll tell you how I take care of this port when I bathe. All right, because you don't want to get your port wet and you want to keep it clean. So what happens ordinarily is during chemo, as I mentioned before, they take your blood, and then they start the IV for the chemotherapy drugs. All right, the set of 3 drugs. So it's all intravenous. So the blood work is important because they want to see that your blood makeup is okay before you have the treatment, so you're well enough and you're healthy enough to be able to take the chemo drugs because they're so evasive. All right, so I didn't get this done till after the 3rd treatment just because of scheduling, and it was a mistake, because if I had known enough before, I would have gotten this done sooner. Now, the thing with the port is only expert people, nurses, can use the port. They know how to use it. They know how to, find the little bumps that they need to find to be able to prick you with the needle and insert the little plug for the intravenous uptake or downtake of the drugs, right? And also they can, those expert nurses also know how to draw blood from the port. All right, so in most cancer centers or wherever you're getting your treatment, there's going to be 1 or 2 nurses who know how to do this, and none of the other nurses will really know how to do it. So make sure that when you go to your treatment center, you find out that there's a nurse that can actually do this, because it would be pointless to go and get the surgery if there isn't a nurse. And the nurse that comes to deliver your treatment will say, "Do you have a port?" And you'll say yes, and they'll go, "Yay!" Because they don't, as much as possible, they don't want to use your veins. Now, I have very, very thin veins, very small veins, and they don't, at this point, they're all a bit tired, from having so much blood drawn and PET scan stuff and CT solutions and, God knows whatever else I've gotten in my veins. And finding them is really hard on my body. So, and at a certain point, it gets very stressful on the veins that you have been using a lot. So the port really is very helpful. So in advance of your chemo schedule, make sure that you also schedule this. It's just a 4-hour day um, in an operating room, and you're done, you know. And then, of course, once you're done with your treatment, you have to get it taken out, right? Um, so that's all I'm going to say about the port. Is there anything else I should say about the port? Let me think. I don't think so. What they're going to use this for mainly, so if you go for a blood transfusion or they're going to take blood from you, um, more than likely they're not going to use the port because of just the location of where it is and the arteries that it accesses. All right, so there are certain procedures that cannot be done on a port. All right, and if you go to the emergency room or you're in a hospital, they're not likely to use the port for anything. All right, they're going to go searching for your veins. But for chemo treatment, it's really it sort of is very helpful to have one. And I think that's all I have on the port. This is a sort of a quickie one that I wanted to uh, make. Now, I knew there was something I forgot to tell you about the port, all right? So I'm going to try and attach this to the end of what I did before. And that's keeping it clean and dry, all right? Super, super important if you have one, all right? Because you don't want to get it infected. Now, keeping it dry, you're going to be bathing, right? Showering or a hand bath or a hand body bath, whatever they call it, when you use towels and stuff to clean yourself. So all of that needs to be away from the port, all right? And what I've discovered, a way to do that is I bought a bottle of spray adhesive bandage, all right? And it's basically just a little aerosol thing of this spray, and you just spray the port wherever it is, right? You just spray it and spray the secondary part of the port with the spray, and it's like a band-aid, and it covers it, and it's waterproof, all right? And you let it dry for a few minutes, and then you go and you take your shower, bath, body, whatever, ablutions that you do, and that's helped me. And what happens is after a couple of days is the adhesive bits fade off, all right, or they just fall off, all right, and or you can peel it off. And then the other thing that you might want to consider is if you use when you use the port during your treatment or after your treatment, you keep the bandage or band-aid on that the nurses will put on after you're done. All right, you keep it on for a couple of days. All right, so let it all heal before you take it off. You ideally want to keep the port clear of anything. You want to keep it without coverings of any type, so it airs, all right? So, but after treatment, I just keep the little band-aid on for a couple of days, and then I take it off and discard it, okay? So that's a little bit about what I do to keep it clean. Now, if you do see anything that's infectious style, or infectious-like, sorry, then go to your emergency room because it's very serious, all right? So you want to keep it clean and dry, and remember when you get out of the shower or the tub, or if you're wet, just make sure you dry the port area very quickly and expediently. Keep it really, really moisture free. All right, that's all I have. Sorry, I missed it on the first part. I knew there was something I forgot. All right, so that's it. Signing off. Bye.